Usually on a Monday, we talk money on a Monday. We're talking money and your health. Because one of our producers recently noticed that sugar-free drinks from the Coca-Cola company have shrunk down in size. It now matches those of the regular sugar drinks. The 330 ml cans are now 300. You have the 500 ml plastic bottles are now 440 milliliters. And for some time now, since the introduction of the health promotion levy or the sugar tax, they've been selling their products at different sizes, supposedly that people would choose the cheaper and healthier sugar-free variants over the regular ones. So we approached Coca-Cola and they confirmed that they are adjusting the sizes and have sent notices to the retailers. But when we asked them if they had also dropped the retail wholesale price accordingly, all they would say is that they would only give retailers recommended retail prices. And from what we have seen and observed on our supermarket shelves, the prices of the drinks are now largely the same and are the same size. And yes, we know the sugar tax was to be absorbed by the manufacturer and there was no obligation for them to charge a higher price for sugary drinks than the sugar-free drinks. But surely this goes against the whole idea of the sugar tax in the first place. How are consumers being incentivized to choose drinks with less sugar? Petronell Kruger is the programs manager at HEALA, the Healthy Living Alliance. Good morning, Petronell. I really appreciate your time. Has the health promotions levy, the sugar tax, has it had an impact on consumer behavior?
Good morning. Yeah, so I think that there's two important things, and I'll just start by explaining this phenomena that you're seeing and then addressing how the health promotion levy has actually changed consumer behavior. So what we're seeing Coke engaging in is called shrinkflation. It's a common tactic used by the food and beverage industry when they need to up their profits, but they realize that consumers are cash-strapped. So what they do is they change the size of their packaging downwards so they don't have to change their price point. And this is because consumers are more sensitive to price changes than quantity changes. Now, in terms of whether or not the health promotion levy has worked and how it should interact with this phenomenon now with the non-sugar drinks, so firstly, just to say, the health promotion levy has now been in force since 2018, and we have really good and convincing and repeated studies that have shown that it has firstly changed consumer behavior, especially in low-income consumers who are more likely to feel the negative impact of diseases associated with high sugar intake like diabetes and unable to pay for things like insulin. But we also have seen, and this is what's very interesting, that companies have engaged in reformulation of their products, which is reducing the amount of sugar and to some extent reducing their packaging sizes. So the question you pose is very interesting. Is this actually undermining the sugar tax? I mean, the long and the short is not really, because effectively the point of the health promotion levy was to make sure that consumers ingest less sugar, and that is still occurring. Whether or not there was an incentive to move people over to what we call alternatively sugared or sweetened beverages, that's not per se something that the health promotion levy was attempting to achieve. Of course, what really is the point of the health promotion levy was to get people to drink more water. But we'll have to see what happens here. I don't think this is motivated by health whatsoever. I think this is simply a response from the Coca-Cola company to ensure that they can maintain their profit margin.
Because also the sugar tax isn't ring-fenced. It does not necessarily go to promoting public health. It just goes into the general fiscus. So what is a health promotions levy is just another general tax which goes to whether it be divided amongst health, or it could go to education, or it could go to policing. It's just a general tax which goes into the fiscus.
That's a very fair concern and comment. So one thing that Healthy Living Alliance, my organization, has been calling for is that the health promotion levy is ring-fenced for non-communicable disease prevention. So just to tell you and your listeners that Non-communicable diseases are now the leading cause of death in South Africa, and we've seen last year's statistics, South Africa has indicated that it has risen with 60% over 20 years, which really is putting it at the level of the HIV/AIDS pandemic. And we're going to be seeing a lot more deaths and what we call long-term disabling effects, so people living with diseases that debilitate them. So we want that fund to be ring-fenced for non-communicable disease prevention. But I should also say that a lot of that funding has been allocated previously. It's called soft ring fencing, so where the government doesn't make a formal commitment, but does in fact allocate certain funding for certain programs. So a lot of that funding has been allocated previously to cancer studies and cancer prevention and treatment schemes, which is very important. But seeing something more formal would be very good. And I think especially in South Africa, we're all very tense about taxes, and we all are really feeling our own bank accounts being stretched. So we want to know that if we're being taxed, that we're being taxed for something that's going to be allocated properly and not necessarily going to general government.
But if the sugar tax was to be absorbed by the manufacturer, does it affect the consumer then at all if the manufacturer is then tailoring sugar content to also then meet its budget so that it doesn't pay more? Does it necessarily impact the consumer at all directly?
No, so if the sugar tax is wholesale being absorbed by a manufacturer, then no, there won't be any pass-through impact, and the average consumer then won't see a difference in how they consume, which is why the health promotion levy has two goals, which is both to change consumer behavior but also cause reformulation, because the manufacturer will then struggle to maintain a profit. So what they will do inevitably, and which has been shown in multiple studies, is they will then of their own accord reduce the sugar levels in their products. So even though consumers might be purchasing the same products, they'll be purchasing a healthier version of that product. And over a long term, and I suspect this is what we're seeing now, consumer tastes will change and they'll be less likely to notice the reduction in sugar. And if I had to give an educated guess, I would say that Coca-Cola has probably been thinking about making this change, but they just needed to have the consumers exposed to reduced or no sugar alternatives for long enough that it can become sort of their main product that they want to purchase.
Petronell, really appreciate your time. Programs Manager at HEALA, the Healthy Living Alliance.